looking outside and look like
This
on my
conference will
trees
now
in the
be recorded.
backyard has fallen off the tree from all that wind that we got this afternoon. So
Mhm.
luckily we
Oh
didn't
my
have any
goodness.
trees to go down. Yeah, had the power outage. I was so worried about my deep freezer and my food out there, but thankfully nothing defrosted. So we are all good, and I hope that's the case for you all too.
God takes care of you.
Yes, yes, he will. Yes, he will. So I'm going to go ahead and get us started. Um, Welcome everybody to our town hall meeting for October. We'll have another one in November. We're going to try to keep having one at least once a month until we can somewhat get back to normal, whenever that will be. But we're going to do these once a month. And once again, I'm Ursula Robinson, the executive director, and I have with me on the call Nidra Baldwin, our outreach and education director. And I believe Dr. Culler is going to be joining us in a little bit by phone as well, because he's going to obviously want to talk to you all about some medical updates and especially some stuff about COVID. So let me go ahead and get us started. Certainly across the world, the coronavirus is roaring its ugly head back again. And cities and states alike are trying to put restrictions up again. In North Carolina, we have seen record-breaking cases of COVID in just the last 3 days in a row. The last 3 days in a row this week, we have seen record-breaking new cases of the COVID virus. Later, Dr. Keller will talk with you about what's going on in Guilford County, but those record-breaking numbers that I'm speaking of are for the state of North Carolina. Now, you might say, well, we had record-breaking numbers in the spring, too. That's why we shut down. Well, this time is different, and it's different because we're all tired of this mess. We have been through this thing a long time. We're going on 7 months now. We've got hospital staff that are tired. We got family members who stopped visiting each other during the spring lockdown, and now they're finding it hard not to visit their loved ones, especially now since we're getting ready to go into the Thanksgiving holiday and the Christmas holiday, which is when families get together. So it is definitely hard. The staff and I at Pace of the Triad, we are just so ready for y'all to come back to Pace. You just have no idea. We just welcome the opportunity that we can greet you all back. Today I read an article called Finding Hope When Everything Feels Hopeless. I'm going to say that again. The article was called, and if you could mute your phone for me, that would cut out some of that static that I'm hearing. So make sure your phones are on mute so that everyone can hear. And even if you're not saying anything or have any background noise, it's still good to put your phone on mute because I can even hear you breathing. That's just how these phones pick up sound so well. But anyway, again, the article was called Finding Hope When Everything Feels Hopeless. And the writer said, and I have to agree with her, that right now there's a perfect four-letter word for the moment that we're in. And that four-letter word is hope. 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 And yes, even after 7 months of dealing with this pandemic, during an emotionally exhausting election period, I think y'all would agree about that. I'm so tired of seeing advertisements for this election. I don't know what to do. Not to mention, we've got winter coming upon us. I still believe, and the author of this article I read agrees, that we should all still remain hopeful. Did you know that hope is critical for your physical and your mental health? According to some psychologists, hope helps guard us against sadness, against anxiety, and it protects us from stress. Research shows people with high levels of hope are better able to cope with the setbacks that life will cause us. And if any of you all had parents and grandparents like mine they used to always tell me, if you haven't gone through something yet, just hold on and live a little longer because you will go through something in life. And we are certainly going through something right now. And hope allows us to fight against this. It allows us to keep our spirits going emotionally. So, the researcher in this article I thought had a great idea. She said that hope should be our PPE. Now, y'all probably have heard of PPE and heard it to mean personal protective equipment. That's what most of us are used to PPE meaning. But this article says that we should think of PPE, as far as hope is concerned, to stand for personal protective emotion. Personal protective emotion. So, what exactly is hope? Well, my pastor says that hope is a yearning or a longing for something possible but not certain. So, the good news about hope is we can all learn to be more hopeful. There's 5 little things that we can all do, y'all, to learn to be more hopeful if we're not there already. So, number 1, remember first and foremost that hope is a choice that we make. You can choose to be hopeful or you can choose not to, but it is a choice that we make. So if each one of us in our mind would say, instead of being doom and gloom, we're going to be hopeful today. And some of us, we might have to take it day by day, and that's okay. Some of us might even have to take it hour by hour, especially if you're having a bad day with your health. That's understood. Understand. Number 2, practice looking into the future and imagine what life is going to be like when we can get back to normal, when we can get back to being with our family and friends. And for us at Pace, we're imagining what it's going to be like when all of you all come back to Pace and we can just hug on you and love on you. That's hopefulness. That's looking into the future for us. That's what makes us hopeful. That's the excitement. We got all kinds of activities we're going to plan around that great reunion back at the Pace Center. The third thing they suggest that we do is set goals for ourselves, and it can be just little bitty goals. I'm going to walk outside and go to the mailbox and back today, or I'm going to use my walker or my wheelchair and go from one place to the other without somebody trying to assist me. I'm going to have somebody standing by just in case, but I want to try to do some smaller things for myself as I go along. Number 4, watch out for the words that you use. I'm going to repeat this because this one is so important. Watch out for the words that you use. When you don't have hope or when you're negative, you'll say something like, this pandemic is going, we're all doomed because of this pandemic, or ain't nothing going right today, or everything is terrible today. But if you have hope, you will find a positive way to think about things. For example, instead of saying what I just said, you'll say, we're going to get through this. Or you might say, this too shall pass.
Mm-hmm.
And lastly, the last thing about hope, if you want to figure out how to get more of it, spread hope to everyone that you meet. Hope is an emotion, believe it or not, that is contagious. And believe it or not, everybody right now during this pandemic and certainly during this election period needs some hope. We all need to be hopeful, and we need to be role models for our grandchildren, for our children, and other family members and friends. The article said, hope begets hope. Pass it along, everybody. Thank y'all for listening to me on that part. Now I need to change subjects on you and talk about voting because it is important. How many of you voted so far? Let me hear you say yay.
Yay!
Yay!
All right.
Yay!
Okay. Okay. 5, 6.
Yay.
I think I might have heard 6 now. 7 people. Okay.
Yeah.
Excellent. All right.
Yay.
I love it. Good. I'm so glad that. Excellent. So glad that you have voted. Now, If you have not voted yet, if you haven't voted yet, you might want to grab a pencil or a pen because I'm going to give you some phone numbers of places you can call that will actually transport you to the polls. And they will you can either vote in your car or you can get out and go in and early vote. And I even have a number of a place you can call on election day if you choose to go on election day. We don't advise you waiting until election day because I'm going to tell you those lines are going to be long next Tuesday. If you can get in there before this Saturday, please do, because Saturday is the last day of early voting. So the first number that I want to give you is the Guilford County, there's a number for the Pulpit Forum. And they are doing certain days, but let me just give you the phone number and you can call them and they'll tell you. Put your phone on mute so these other folks can hear the number that I'm going to give them. 336. Put your phone on mute. Okay, here we go. 336-904-3233. I'm going to repeat that again. 336-904-3233. Then SCAT is also transporting people, and let me give you that number. 336-333-6589. Repeat that. SCAT 336-333-6589. The Beloved Community Center is transporting. Their number is 336-279-6201. 336-279-6201. And the last number I have for you is the Guilford County Democratic Party. The Republicans are not transporting, but the Democrats are, so we want to give you their number. It's 336-908-6111. Again, that's the Democratic Party for Guilford County, and that number is 336-908-6111. All right, folks, there's no excuse not to vote. Got transportation. Let's get out there and make our vote count. Three more things, and then I'm going to let Dr. Culler talk. I'm sure you've seen from the radio advertisements in between the elections as well as the TV, it is Medicare open enrollment season. It started in October, and it's going to go on to December 7th. Now, I'm home working most days, and I can see it in my phone. I don't know if these people don't realize that I'm not quite old enough for Medicare or not, but my phone is ringing off the hook with people trying to get me to come on to their insurance plan. If you are getting those calls, please don't pick them up because they do a lot of tricks to get you to sign up for their plan, even though you don't want their plan. But just by answering the phone and sometimes answering some of their questions, they're tricking people into enrolling with them. And I know you all have heard me say before, when you enroll in these other plans, it automatically kicks you out of PACE. Automatically kicks you out. So please try to just not answer those phone calls, if you will, because there's a lot of trickery with open enrollment season. Hopefully you all are here already got or will start receiving the 2 surveys, the HOS-M survey, the one that talks about what can you do, and the other one is your satisfaction during this pandemic. It's called the Pulse survey. I believe both of those surveys is going to come in an envelope with PACE of the Triad's name on it. Please take the time to fill those out and return those in those self-addressed envelopes. Those are very important for us to have, not only for Medicare, but also so we can improve ourselves if there's some things that we need to work on. And then the last thing before I turn it over to Dr. Culler is from Lucilia. You all know that Lucilia is our center manager. And unfortunately, Miss Lucilia couldn't be with us tonight. She had to do something at the house, but she wanted me to tell you all that Let us not be weary in well doing. That was the quote that she sent me. She said, now more than ever, it is critically important that we keep our guards up, especially with the cold and flu season upon us. Due to the recent increase in the coronavirus cases, the Adult Day Health Center capacity is still at level 1.5. We continue to keep our guards up by using the three W's, which is put your phone on mute. We are wearing masks, washing our hands, and waiting 6 feet. And we're doing other safety protocols such as routinely sanitizing areas that are touched often. We're also asking staff and participants to please remain home if they feel sick. Our drivers are continuing to sanitize the vans in between trips, and we are continuing to take temperatures along with the HCCs or the nurses calling participants before they get transported to ask those screening questions. We want to thank you and your caregivers for your continued partnership and resilience during these unprecedented times. And the last thing Lucilia said was, remember, we're all in this together. Now, we are upon the holiday time, so let me remind you of the days that the center will be closed. So if you call, you're going to get the answer machine, and then if you have an emergency, you know to hit button 1, and it'll go to the nurse who's going to be on call during the holidays. We're going to still be closed on Thanksgiving Day this year, Christmas Day, and New Year's Day, and then MLK Day in January. So those are our 4 upcoming holidays: Thanksgiving Day, Christmas Day, New Year's Day, and Martin Luther King Day. All righty. Dr. K, are you on yet?
I am on here. Can you hear me?
Great. I can hear you. I'm going to turn it over to you, Dr. Culler.
All right. Thank you, Ursula. And that was a great summary. My power is out here at home, but I'm using my cell phone, so I hope you can all hear me well. There'll be a chance to ask questions of any of us in a few minutes. I just want to bring you up to date on what's happening with the COVID pandemic. As Ursula told you, there's a surge basically nationwide and actually worldwide where more cases are appearing now over the last several weeks. And we have seen that here in Guilford County as well. There's been a steady rise in number of cases of COVID, and the hospital census, the number of people in the hospital continues to go up. I think it's at its highest that it's ever been. In July, it was high, about 70 patients in the hospital at one time. It went down into the 30s, but now it's back up to more than 80 now. So it is increasing in frequency, and more people are going into the hospital. Good news, though, is that there are fewer people in the ICU. And this may be because that the people now that are getting it are younger and not the nursing home people that were having a real problem with earlier this summer. So younger people seem to be more resistant, but they still get sick and have to go in the hospital. Also, it seems that hopefully that, as we would expect, doctors are getting better and learning how to treat this, what works and what doesn't work. So our experience with treating COVID has improved medical care. Because hospitalizations are going up, this is not really surprising because viruses tend to increase more in the winter months. It's not because of the cold weather, it's because people tend to be more indoors because of the cold weather. And when you're indoors more, you're closer to each other and a greater chance for passing germs back and forth. And it's not just the COVID that can be passed back and forth. There are colds and other viruses and germs. But the big one I want to mention right now is influenza. Influenza is the total word for flu. Now, a lot of people think the flu, oh, that's just a cold, no big deal. It is different than the cold. Influenza kills thousands of people every year in our country. And last year and the year before and the year before, we lost several of our participants to influenza. So let's not forget about that. Because of this, we've had 100% of our staff get immunized for flu because I don't want anybody in our staff to contract it and give it to one of our vulnerable participants. We're hopeful that we can get 100% of our participants vaccinated. We've been working on it over the last month, and hopefully you have all received your flu shots. If for some reason you feel that you don't want a flu shot, talk to me first. I'll try to convince you because it's a great idea. It's very safe. It will not give you the flu. It won't make you sick. It might give you a sore arm, but that's okay. It may save your life. So if you haven't received the flu shot yet, let the office know, and we will make sure that you get it as soon as possible. From a medical standpoint, just where things are standing with the vaccine, there are a number of vaccines that are going through their trials. It just takes time to see how effective these vaccines are, to see if people get sick or not, to see if it works or not. And it just takes time. We can't rush that process, but we're hopeful that there will be at least one vaccine available by the end of 2020, by maybe Christmas time. That would be like a Christmas present. And it will be immediately available to the highest risk people. Probably my best guess is that it will be available to PACE participants by January, maybe the late half of January. And we will certainly offer it and encourage it and provide it. And then I will personally make sure, looking at the information, to make sure it is safe and effective and a good idea. I will certainly get it myself because I don't want to get sick. And I think those are the main things. I want to also assure you that PACE, the Triad, is practicing the utmost safety protocols that we can. No one has ever caught it at the PACE Center, so we feel very good about that. Our PACE participants, we did have a number of PACE participants get it in the summer. They stopped getting it, though, in August and September. We were happy about that, but in the last few weeks, we have had a couple of people that have turned positive, but they did okay. They did not catch it at the PACE Center. They got it through their family. And speaking of family, Thanksgiving is coming up. And, I know our family, we are not going to get together physically. We're fortunate enough to have internet, and we are going to get together by Zoom. If you have that opportunity, that's great. But find other alternative ways of getting together rather than a big family reunion. So Ursula, I think that's the main things I wanted to touch on today. Should we open up for questions?
Yes, let's do that. And I want to say to those of you on the phone that when Dr. Cullors says that we've had a number of participants to get COVID, I want to quantify that because I don't want you all to think that we've had a bunch of people. Our census have been around 230 some people since this pandemic happened. And what we have seen through the course of these 7 months is we've had 19 participants to get COVID. And most of them, as a matter of fact, I think it was 70-some% of them were in the nursing home. So I think that's important to quantify that out of 230 some people, 19, and most of them were in the nursing home, contracted the COVID virus. All right, so let's open up the lines, Nidra, and see if anybody has any questions.
I'm Sue Hood. I have a question. We get bingo once a week, and we can win either 200 to 300 points. And we have they send us a pack once a week where we get points for doing them. And I was wondering, with all this y'all closed down and everything, how are we going to get our points, and how are we going to spend them? Because they said the store wasn't going to be open for a while, and now they talk like they don't know when, But I had 3,000, over 3,000 points before it closed.
Ooh, good gracious!
And I got 300 points Tuesday from bingo. And I usually get 1 or 2 bingos every Tuesday. And then this packet they send home You can get 200 points to 100 points, and you add all that up and add it to what I got. I got a lot of points, and
Ooh,
everybody
yes,
else
you do.
has too.
Ooh, yes,
And
yes. But you know what? I don't want to stop y'all from getting your points, because that wouldn't be right either. I want you to keep getting those points and letting them add up so that when you can get back to the center and go through the store, you can get exactly what you want. I wonder though if what we might have to do one day, and I'm just saying this out loud. I haven't talked to a soul about it, so y'all please don't hold me to this. I'm just brainstorming out loud. I'm wondering if what we can do after the holidays is set up appointment times and maybe have some folks come through and go through the store on an appointment time. Or could we bring the store out to the patio and let folks who are not there during the day come in and go through the store? I just got to think that thing through and talk with Ari and see how we can do it. Or maybe we can have you send you some pictures of some things that we have, and then you order them. That's another way of thinking about it. So let me stop talking, because I don't want to promise something that I can't deliver. And I will either put something in the newsletter, something once we can get something resolved, and let you know. Okay?
do you think that maybe you could get something up before Christmas? Because I'm on a limited income, and I got 10 grandchildren and 5 great-grandchildren, and I just don't have that much money. And I was saving my points up to get them something in the store, which otherwise I wouldn't be able to get them anything.
Okay. Well, I will do my best to get in touch with Ari tomorrow and have her get with her team and let them start figuring out if there's anything that can be done before Christmas, and then we will certainly let you all know. Okay?
I would certainly appreciate it.
All right, my dear. Any other questions?
Yes, my name is Lisa Penix. I'm asking if people have procedures in the hospital, are they letting the family in with them, or are they just letting the patients in?
I'll let Dr. Culler answer that one. Dr. K, did you hear that question?
Sorry, I was talking on mute.
Oh yeah, that happens all the time.
Yeah. So in the hospital at Green Valley, that's where they're putting the COVID positive people, and I believe that visitors are not permitted in there. But in the main hospital, I think very limited visitation is allowed now. I don't hold me to that. But that's my understanding, that limited visits with family members are allowed if there's a compelling reason for it. So that's my best understanding right now. I'm not sure if anybody else knows anything other than that, but that's my understanding.
Yeah, I was going to say that's my understanding as well. You won't be able to bring several family members. They only allow one family member, but you will be allowed to have a family member with you.
Yeah.
Okay.
And where is this to?
Say that again.
I'm sorry?
Where is this to?
So the main hospital, main Cone Hospital or Wesley Long Hospital, if you're in there for some other reason, then a limited number of family members can come in. But if you're at the COVID hospital, the one on Green Valley used to be the Women's Hospital, that one is just for COVID patients, and so they don't want visitors going in there.
I have a friend whose husband is in the hospital with some other complications having nothing to do with the virus, and his is the only one who can go in Moses Cone to see him.
Okay, that sounds right.
Just one person, right? Yeah.
Just one person.
All right, thank you.
That's
That sounds right. Thank you.
Yeah,
You're welcome.
thank you for sharing that.
You're welcome.
We are at 6:30, but let's take one more question if anybody has one.
When do you think we might go back to PACE?
Ooh.
Well, it's a big question.
Oh, my goodness.
From the medical point of view, it depends on when the pandemic comes under control. And I want it sooner than later, but realistically, the pandemic won't come under control for a year. We're hopeful that it might be sooner, but that doesn't mean that we're not going to have people come back to PACE. That may be there's different factors there, and I'll let Ursula take it from there.
Yeah, there'll be several factors that we'll take into consideration, and your social workers should be calling you all and talking with you all about how well you're doing, what kind of support that you need, and then you need to tell them, tell them why you're ready to come back to PACE. And then when we can get to the point where we can bring people back for non-medical reasons or non-family member reasons, we're certainly going to do that. I would like to say we're going to do it certainly by next year, early part of next year, but I don't want to promise something that I can't guarantee because, again, we've got to get control of this virus. And like Dr. Culler said, we've been very fortunate that no one at PACE has gotten it, and we want to keep it that way by making sure that we are overseeing people very well that are at the PACE program. So we certainly will keep you posted. Every newsletter, I'm going to try to make sure I put something in there. I'm sure Dr. Culler will as well. So keep reading, keep coming to these calls every month, and we'll just keep you updated as we go. And remain hopeful. Please do that. Okay, everybody. Thank you all for getting on the call. I appreciate you, and I love all of you. Y'all take care of yourselves, okay?
You too.
Okay.
All right.
We love you.
Bye.
All too.
Love you. Bye-bye.
Bye.
Bye-bye.
Bye.
Good night. Bye.
Bye-bye.
Bye-bye.
Yeah. That's over.
All right. Ursula,
Yes.
this is Kia. Just saying hey. Bye.
All right.